Folks, thanks for joining us today. My name's John Dubach with Premier Marketing, and we'll be spending the next 45 minutes or so discussing means of using SureBridge to help fill out your AEP sales and work to set you up for 2021. We're at a point in time now where we're over halfway through the annual election period for the Medicare beneficiaries, and we are looking to make certain that we fill the hopper as much as possible there on the front end and make certain that we're utilizing a lot of that marketing activity to set us up throughout 2021. Today's presentation is being recorded, and it and follow-up to today's presentation, including the link to the recording, will be sent to all who have RSVP'd for this presentation, and we'll make certain that we answer all your questions as well. You'll notice in the software package, there's a section in there for questions. We have everyone muted on the lines, and we normally handle most of the questions through the course of the presentation, but we will check at the end as well to make certain that we satisfy all of your curiosity and make certain that we have the answers to the questions you need for today. We'll begin with a little bit of level set about who Premier Marketing is, and in the chance that you don't know that, we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, and we work providing insurance services to the public through independent insurance agents such as yourself, and we do so through contracts that are at the highest possible commission levels, and recruiting contracts are available to those who qualify. As I mentioned, being founded in 1968, we've recently achieved a milestone in our history, and that's our 50th anniversary. We think that's quite an accomplishment for what began as a small family agency in rural Nebraska that's become one of the largest marketing organizations of its type in our space. And we do so through a full portfolio of insurance products, including the Medicare programs of the base medical for Medicare Advantage and Medicare supplement programs, along with the standalone Part D prescription drug programs. And we also offer, however, a full portfolio of life insurance and annuity products, including final expense life insurance and, pre-need programs. I had a question flash, and it kind of knocked me off my pitch here, I guess. We also offer long and short-term care programs and disability income plans, and the ancillary benefits like what we'll discuss today in the dental, vision, hearing space, critical illness and cancer programs, and hospital indemnity accident programs as well. The Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers in your space as well, and that carries over into the philosophy working through standalone prescription drug plans where those national carriers are with our organization and available to you as well, as I'm certain you're well aware. It does list the Envision RX program on this slide still to remind me to speak to the fact that that is no longer available for broker distribution, even though we had it in the past. They pulled it from the entire broker space and renaming it, relaunching it as Elixir moving forward. We want you to be aware of that in the event you have that contract to protect your business with that book as well. When we speak to the Medicare supplement portfolio, it's rather robust, and we have specific programs in play to help you be successful in that space as well. And in the ancillary arena, where we're to discuss different programs today with our partner SureBridge, you'll find in the different categories that we have the national leaders there for you. And this is a great way, which is part of our discussion today, to fill out a portfolio, give you another means to market, and make certain that we're covering the needs of our prospects and clients moving forward. When we look at the Medicare space itself, it's a burgeoning market, obviously. We hear of the silver tsunami, the aging of the baby boomers, one every 10 seconds, 10,000 a day. If you go just off of age, however, we're not giving you a true number, since there will be a percentage that turn 65 and not access all their benefits at immediate eligibility. But there's also the medically disabled under the age of 65 that give us a strong market and gives us the need to address a diverse population that has health concerns, has income constraints, and therefore has needs for us as independent brokers to have that portfolio of products available to them to address these different needs. And we do so by helping them in each of their choice channels moving forward, because they have a number of choices to make about their coverages. Technically, they don't even have to pick up Part B. Most do, thankfully, and pick up either drug coverage or additional coverage with a standardized modernized Medicare supplement plan, or through one of the Part C Medicare Advantage programs as well. It's important to note that in each of these categories, they'll have choices for additional coverage available to them, and that's part of what we want to make certain they have access to through us, is the ability to add on to their dental coverage if it's a part of a Medicare Advantage plan. Generally not in the MedSup or PDP world. There are also the concerns of making certain that we take care of additional coverage they may have, including hospital indemnity programs. And we want to utilize that to its full strength to fill in the gap sometime in the Medicare Advantage arena, or address a need not covered at all by a percentage of the population, or add to some things that they may have with other coverages. Since we are in the Medicare arena, we want to make certain that we give you the opportunity to have a translation guide for you and your prospects. This will come to you as part of the follow-up to today's presentation. And as I mentioned before, it's important to note that we're not only harvesting now through AEP, through a accelerated marketing and sales process, but we're also planting seeds moving forward. And so we've asked our friends at SureBridge to come on and visit with us about the programs they offer, the unique structure that they have with their products, and the things that they can do to help us be successful now and in the future. So we've asked Seth Groff, he's a sales director with SureBridge, to come on and visit with us about the programs that they offer and how they can help us be successful at this time. Seth, I'm going to turn control of the systems over to you, and the helm is yours, sir. And I thank you for coming on and helping us today.
All right. Well, thanks, John, and thanks everyone for jumping on today's call. As John mentioned, today we are going to talk about finishing AEP strong and also preparing for 2021 and talking to your clients about ancillary products. And, you know, this is always a busy time for people that work in the senior market. And, you know, today, if you're listening to this live, it's November 17th, and there's 13 days left in AEP. And if you're an agent that hasn't been selling ancillary products in conjunction with either a MedSup or a Med Advantage plan, you might have the mentality that there just isn't enough time. But I would argue there is still plenty of time to talk to your clients about ancillary products during AEP. You know, if you do the math on it, there's still 31% of AEP left. So there's plenty of time. And I kind of like to use the football analogy. You know, we aren't even in the fourth quarter of a football game if you look at the days during AEP, and there's always time to finish strong. I like to use the reference of Super Bowl 51. If you recall, it was the Patriots versus the Atlanta Falcons. The Atlanta Falcons were up 20-3 late in the middle of the third quarter, and the Patriots finished strong and came back and ended up beating them 34-28. And the point of that is that a lot of agents out there, they, you know, hit AEP hard, they have some success, and then they coast these last couple weeks. Don't fall into that category. Finish strong, and even if you aren't talking about ancillary products, you still have time to get ready. And again, the great thing about ancillary products is that once you get past AEP, you can still talk about these plans to your clients. So if you aren't currently selling ancillary products, I understand that it might seem like a daunting task, right? You're like, man, I'm just busy, I'm running appointments. and I just don't have time. But really, I'm going to simplify it for you. There's really only 3 things you have to do, and we are going to actually hit on all 3 of these today. So number 1, learn the products, right? We're going to hit on that. Number 2, learn how to sell the products. Today, we're talking about Prime DVH, a dental vision hearing plan, and then also SureBridge's HospitalWise. And these are 2 products that are easy to sell in conjunction with either a MedSup or a Med Advantage plan, depending on your client. And so I'm going to outline how to bring it up and how to present it, and it's going to be easy for you to sell. And then finally, just learn how to quote and apply, because SureBridge, everything we do is online, and so you do need to know how to quote and apply for these plans before you go get in the client. But again, I'm going to walk you through just briefly how to set up the quote so you'll have that knocked out and ready to go. If you're not familiar with SureBridge, I always describe us as one of the fastest growing ancillary carriers in the marketplace. And in 2019, we issued over 260,000 policies. And when we did that with an underwriting team of basically 2 people. And so the only way that we can issue that many plans with only 2 people is that we leverage technology. And so as I mentioned before, everything's going to be quoted and applied for on a point of sale tool. You're going to have several different signature options, including a face-to-face signature if you're meeting with people, an email signature or text signature, or even a voice signature if you're selling over the phone. And so we make it as easy as possible to incorporate these products into your sales process, and also as easy as possible for your clients to sign up for these plans and get coverage issued immediately. You can see up there that over 90% of the submissions are issued in real time. Part of that is because we use either guaranteed issue underwriting or simplified underwriting. Guaranteed issue is going to have a few knockout questions, but there's not going to be any health questions. So most of those are going to be issued in real time. And even if it's simplified underwriting, all we're doing is underwriting based on the questions on the application. There's no MIB, there's no script check, there's no phone interview. So as long as they can answer the questions favorably for like a HospitalWise plan, there's not going to be anything that's going to kick that out as long as they can answer the questions favorably. So the point is, we try to make it as easy as possible to sell these plans, because we know that ancillary products probably aren't your primary focus. And if it's not easy, you're not going to bring it up. So we want to make the process easy so that you do talk to your clients about the benefits of these plans. SureBridge does have a full portfolio of ancillary products. We actually sell a lot of plans in the under 65 market as well in the over 65 market. Obviously partnered with Premier. We're always usually primarily talking about the over 65 market, but your contract actually gives you access to both products. And when you look at our portfolio of products, you'll probably be like, whoa, Seth, where do I begin, right? And the good news is I'm going to really simplify it for you. If you're focused in the senior market and you're primarily selling MedSup, so that Part A and Part B, look at Prime DVH, okay, which we'll talk about today. Prime DVH stands for dental, vision, hearing. If you're primarily selling the Med Advantage plans to your clients, you're going to want to look at HospitalWise, because we know that when you go with the Med Advantage plan, that comes with some additional exposure, and you're going to need some clients might want an ancillary product to help cover some of that exposure. And if you're selling both, depending on your client and their unique situation, which is always a good strategy to have, then you're going to want to pay attention to both, because then you can pivot depending on which core product you sell. If you're not selling ancillary products, you've probably heard this pitch before, but just remember that the more products that someone has with you, the better the client retention, right? And when you look at your core products, and I know, Integrity sometimes does have some proprietary senior products, but a lot of the products, the big name, MedSup, Med Advantage plans out there, everyone has access to them. And so if you want to differentiate from the competition, bring up ancillary products, because I'm telling you, there's a lot of agents out there that just don't bring it up. But if you want a different story to tell, these ancillary products will give it to you. Also, additional income. There's obviously a lot of factors that go into this, the size of the policy, the particular commission level you're on. But I will say Premier usually sets agents up with very high commission level. But roughly speaking, if you do one per week, you add $10,000 to your income. So, and that's throughout the entire year. But you can do the math there. You know, obviously during AEP, you're going to sell more than one a week. And so you can really get a good boost in your income by bringing up these plans. And then finally, your clients need them. You know, they are looking for innovative solutions to their problems, and ancillary products can be that solution for them. So again, we're going to talk about HospitalWise, and then we're going to jump into Prime DVH and then wrap it up just with a real quick quote to show you how easy it is to quote these plans. So with HospitalWise, again, this is primarily going to be sold in conjunction with Med Advantage plans. You know, over 34% of Medicare beneficiaries enrolled in Medicare Advantage plans, and I think that number is probably going to continue to grow after this AEP. And so the point is that there's plenty of people out there that you can talk about this concept. Down in the lower left-hand corner, that kind of explains the need. So you can see that the average out-of-pocket limit for Medicare Advantage plans in network is going to be a little bit over $5,000, and for out-of-network, it's a little bit over $8,600. So the point is that you know, clients that are moving to a Med Advantage plan, a lot of times are doing it for the cost savings, right? Because they feel maybe they can't afford the med sup route, and so they're going there for the cost savings. But with that cost savings comes additional exposure, and so they probably don't have a $5,000 sitting around to cover that out-of-pocket limit if they end up in a hospital or something else that would require some out-of-pocket support to their plan. And so you know, they might be more willing to pay $40, $50 a month than writing a check for $5,000. And that's what HospitalWise does. It provides that cash to help cover that out-of-pocket responsibility. And then finally, you know, that $15,734, that's not specific to seniors. That's just the average cost of the hospital confinement. And you know, I can verify I was in the hospital, it was 3 or 4 years ago, but I was in there for one day, and you know, my bills were I think right up around $18,000 just for one day. Obviously I had health insurance, but the point is, you end up in the hospital, you're going to walk away with some bills, and you know, chances are you're going to have some out-of-pocket responsibility as well, and HospitalWise will pay cash to help offset some of those costs that you have. So here are going to be the basics. Wide range of issue ages, 0 to 90. Obviously, we're primarily talking about the senior market, but if you do dabble in under 65 market, you could write this as well on those clients. It's going to be simplified underwriting. So again, the simplified underwriting, basically, you have to be able to answer the questions favorably on the application. I'll show you kind of a cheat sheet you can use, but there's never going to be an MIB, script check, or personal history phone interview. So pretty easy to get issued, assuming that your client doesn't have any of the knockout conditions. From a rate structure, you can get the individual rate, individual and spouse, individual and children, or a family rate. And then there is going to be a pre-existing condition clause that's going to look back 6 months for the first 6 months of the policy. So if you had underlying pre-existing condition that you were diagnosed or treated for during the first or 6 months leading up to purchasing this plan, and then you received care during the first 6 months of the plan, it's not going to be covered. So like the example that I use is, like, let's say that you broke your leg, okay, 3 months before you purchased this plan. You thought everything was better, but for some reason 3 months after you bought this plan, you were hospitalized due to that broken leg because it became infected after the surgery. That would be considered a pre-existing condition and wouldn't pay. If it happened 7 months after the policy was issued, not a problem, it would cover it. But anything that you're treated or diagnosed for 6 months leading up to the purchase of the plan won't be covered for the first 6 months of the policy. Other than that, no waiting period. And this plan does have a one-time $20 application fee. Now, if you're enrolling a husband and wife, it's only one app fee, or if for some reason you're enrolling them in multiple plans, it's only one app fee. But be sure to point that out because that will be tacked on to the first month's premium. So here's kind of the basics of the plan. First of all, you're going to select the daily benefit and the benefit period. And if you're selling Med Advantage plans, this is going to be a core benefit, right? Because a lot of the Med Advantage plans are going to have a daily copay for, you know, maybe the first 5 days of the plan. And so we really have a lot of flexibility to dial in that daily benefit and also the benefit period to really align with the Med Advantage plan and what the out-of-pocket responsibility is. So that's kind of what you're going to start the policy with when you go out and quote it. But included in that base benefit is going to be an observation benefit. So pays the same if you're held for observation for 12 hours. And that's pretty huge because a lot of times doctors are hesitant to admit people to the hospital due to the additional cost for that hospital room. And so they might just keep them for observation. Well, with our plan, as long as you hit that 12-hour mark, it's going to pay the same as if you are actually hospitalized. Also built into it is a mental nervous benefit that pays up to $250 for a maximum of 7 days if they're confined due to a mental nervous disorder. And again, a lot of our competitors actually exclude that, and we do have some benefit built into it for your clients, which is going to be nice. But after you select the daily benefit and the daily benefit or the benefit period, now it's time to look at the riders. I'm really going to spend the most time on the riders that you'll talk about with your Med Advantage plan. The lump sum hospital confinement rider is probably not one you're going to talk with your senior clients. We see that traditionally sold in the under 65 market, but what it does pays that lump sum first time you're confined to a hospital during the policy year, just to really help offset, you know, if they're, you know, under 65, if they have a high deductible or something of that nature. But really we're taking care of the confinement exposure with the daily benefit for those senior clients with the Med Advantage plans. And I'll show you that here in a slide. But the outpatient surgery rider is one you're going to want to take a look at. A lot of the MA plans do have a copay for outpatient surgery, and we can, you know, do anywhere from $250 to $2,000 benefit. And that's just going to pay that benefit if they have outpatient surgery resulting from a sickness or injury, which is going to be nice. Also, the skilled nursing facility rider is one you're going to want to look at with MA clients. It's going to pay that daily benefit for confinement to a skilled nursing facility resulting from a sickness or injury and following a hospital confinement. So again, a lot of MA plans are going to cover, you know, that hospital stay for the, you know, days 1 through 21 or 1 through 20 on the MA plan, but then the client's going to have a copay for days 21 through 100. And so you can see that we can dial in not only the daily benefit, but also the benefit period to align with that exposure with the MA plan. Emergency care rider, this is going to be one of the more popular riders. The reason for that is, number one, it's not contingent to a hospitalization. So if they go to the emergency room for sickness or injury, they're going to receive that benefit, which is nice. Also, it's, you know, a benefit that they're, you know, are likely to use, and also the cost with it isn't really that much. And so, you know, if you're at the emergency room, you might as well receive some cash for it, and also there's usually a copay associated with the MA plan as well. So this is one that emergency care rider you'll definitely need to take a look at. Ambulance rider pays the benefit if they take a ride in an ambulance. Again, most MA plans do have a copay for that, so that will be added. And then also outpatient major diagnostic rider is one you're going to want to look at, because again, a lot of MA plans do have a copay for outpatient major diagnostic rider, and that's just going to pay that benefit if they have a CT, MRI, PET, CTA, EEG, or EKG diagnostic exams while the policy is in force. So it pays that benefit to the client. There's also wellness rider, but we don't see it sold very much in the senior market or really at all. It's just a little too expensive in my opinion. You kind of just get to where you're just exchanging dollars and not really any value in it. But here's how you really position it with a Med Advantage plan. So on the left, we have a pretty common MA plan. You can see that there's $285 copay for the first 5 days, outpatient surgery, $250 copay, emergency care, $80 copay, ambulance, $200 copay, skilled nursing confinement, $175 a day for days 21 through 100, and then major diagnostic exam of 20%. And so those are going to be a lot of the copays associated with a lot of MA plans. The amount might vary a little bit, but this is going to give you a good idea of how to sell HospitalWise. Over on the right-hand side, you can see what we did. We did 6-day, $300 a day benefit. We did outpatient surgery rider. We matched that up pretty good. Emergency care rider, you see we did bump that up to 200. We could have went with 100, but it's so inexpensive. It's only $3.40. And clients like that benefit. And so we did do 200 on that. The ambulance rider, $200, we matched that up pretty good. Skilled nursing rider, we did $200 a day, days 21 through 100, because that's where the exposure was. And then we did a $200 major diagnostic rider. And we were able to, provide some pretty good protection for that exposure for right at $54.04 a month. And the great thing about this plan is that they receive that benefit regardless of if it's covered by the MA plan. And so like the best example of that is that their MA plan, starts covering that hospitalization stay in day 6. But if they're hospitalized day 6, and even if the MA plan covers it, they're still going to receive the $300 a day from SureBridge. So regardless if it's covered in the MA plan, ours is still going to pay what the benefit is. And so it's just going to be cash to them. Same thing with like the emergency care rider. They pay the $80 copay. We pay the $200 to the client. They have enough to cover the $80 copay and still $120 in their pocket. So just remember that when you're talking to your clients, is that ours doesn't coordinate with the MA plan. We actually just pay cash to the client. They can use it as they see fit. And you might be saying, well, that's fine, Seth, but I'm selling a little bit of a different plan. We have a great tool, which I'm actually going to demo at the very end of it, called the HospitalWise Senior Plan Builder. But basically what it does is it allows you to enter in the MA plan that you're selling, and then it will outline the out-of-pocket responsibilities and then recommend a SureBridge HospitalWise plan and actually quote it for you, which is going to be nice. So I'm going to do a quick demo of that right at the end. But otherwise, here's a summary of knockout medical questions and look back periods. Again, if they've been treated or diagnosed for any of these conditions during the time frame, they will not be eligible for the plan. Our plan does not have any guaranteed issue periods, and so if they have any of these, they won't be eligible. But you can see it's pretty pretty serious stuff. But yeah, these would be the knockout questions. The 4 sales tip for it: number 1, when you sell this, use that HospitalWise Senior Plan Builder. That's the best sales technique that you can use. You should already be explaining the out-of-pocket exposure associated with their MA plan. And then you have to ask them, how are they going to pay for that? Are they going to pay for it out of pocket? Do they have it in savings? Or does it make sense to maybe spend $40, $50 on a HospitalWise to help cover some of that exposure? Number 2, customize a plan. Don't try to go do a one-size-fit-all. Really align the benefits with their MA plan, and showing them, customize it to fit what they're actually buying. You're going to have a lot more success. Number 3, keep premiums within their budget. Kind of $45 to $55 is kind of that sweet spot. You get much over 60, we don't see very good persistency. Remember that, we're recommending the most, but you can always, reduce benefits. So maybe instead of doing, $300 a day for 6 days, maybe you're only covering, $200 a day for 3 days. Something is better than nothing. And so, there's a lot of flexibility there. And so if they, come back and say, well, that's a little too expensive, okay, we'll start reducing some of the benefits, because again, at least having half of it paid is better, or receiving cash to pay half of it is better than none at all. And then finally, just be ready to pivot. This is an education process. You just educate them on what's available. If they say no, they're going to self-insure. Say great, move on, get the MA sale, and you did your job of educating them. I never recommend hard sell in the senior market because it'll get you in trouble. But that's kind of the HospitalWise for Med Advantage plan. The next product we're going to talk about is Prime DVH, so dental, vision, hearing combo product. And again, we see this being sold in the senior market in conjunction with that Part A and Part B, because Part A and Part B doesn't cover dental, vision, or hearing benefits. And so this is one of our fastest growing products. It's got some real good benefits in it, and then also pays very competitive commissions. And so it's just a great plan for you to talk about. But here are going to be some highlights. So remember, it's a dental, vision, hearing combo product. Preventative dental is going to be covered at 100% from day 1 with no deductible. So you get this plan, you pay your premium. You go online, you print off your dental card, or you can wait for it to come in the mail if you choose to have hard copy mailed to you, and you get that card and you can go get your teeth cleaned and get that preventative services day one, no deductible, no out-of-pocket cost. Also, the vision and hearing exams are covered at 100% from day one with no deductible. So again, you get this plan in force. You can go to your dentist, get your teeth cleaned. You can go get your eyes checked, and you can go get your hearing to make sure it's working correctly, covered at 100% from day one with no deductible. So immediate benefits for your clients. Also, when you look at the other parts of the dental, basic dental, no waiting period, and then even the major only has a 9-month waiting period. So your basic is going to be like a basic, filling of a cavity. Your major might include, crowns, bridges. Some more of the more serious stuff does have the 9-month wait. But competitive premiums and commissions, and then we'll talk about the networks tied to this plan and how you can really leverage some good discounts. What the issue ages on this is 0 to 90. And we actually do allow child primaries on this. So if you are working in that under 65 market and somebody just wants to buy it on their kid, they can do that. Or maybe you're talking to a grandparent and they want to buy it on, their grandchild. That's a good thing as well. Also, once it's issued, they can keep it. So, if you write this on a 90-year-old, it doesn't mean that it's going away when they turn 91. As long as they pay the premium, they get to keep it in force, which is going to be nice. Guaranteed issues, so no health questions. So easy to get issue. It is renewable for life as long as they pay the premium. And then the way that it works is that you select a benefit amount. So you select either $1,000, $1,500, or $2,000 of benefit. And that is going to be your maximum benefit, and all 3 types of benefits will come out of that. So your vision, if you go receive, an eye exam, it would come out of that. Or if you have to get hearing aids and use the hearing benefit, it would come out of that. So that pool of money is used for all 3 types of services. And we'll kind of talk about that more specifically. You can use it all for dental, but there are going to be some limits on what you can use for vision or for hearing. There is a $100 deductible, but remember that it's not applicable for the preventative or the vision and hearing exam. So it's going to be, for that basic dental services, vision hardware, hearing hardware, or your type 3 services for dental. There is only one deductible for the entire policy. So if you pay the deductible because of you go to the dentist and have a cavity or something, you don't have to pay it again to get the vision benefit or the hearing benefit. It's only one deductible for the entire plan, and we'll jump on into the networks available for each specific part on the specific part of the presentation. But here's an overview of some of the benefits, the dental benefits available. It's going to be very similar to most dental plans out there. The 2 questions that always come up, and so I just address it on this slide, is, does it cover implants or orthodontics? And the answer is no. Implants are not covered and orthodontics aren't covered. Obviously, if you look at dental plans that do have those benefits, the prices are going to be expensive, and really the benefits aren't really that good. So in order to keep the cost of this down, those 2 things aren't going to be covered. I always recommend going out and downloading a sample policy. So once you get contracted, you can go out, download the product guide, underwriting guide, and in there's going to be sample policies. I recommend downloading that because it outlines all of the different benefits and what type it falls into. And so, when a client says, I need X done, you can go, oh, well, that's going to be covered under basic. There's no wait. Or, they come in and say, oh, I have to have a crown done. Okay, well, that's going to have the 9-month wait with the type 3. But here's how the benefit's going to work. So, your preventative, no waiting period, covered at 100%, and the deductible is not applicable. Your basic type services, so again, let's say you have to go get a basic cavity filled after you go get your checkup. Year 1, well, first of all, there's no waiting period, but year 1, it's going to cover that at 60% up to the maximum benefit. Year 2, 70% up to the max, and year 3, 80%. Year 3 and beyond, 80%, and that deductible is applicable. And for your major type, it's going to be 9 months wait, and then after that 9 month, it's going to be 60% for the remaining 3 months, then jump to covered at 70 year 2, and then 80% years 3 and beyond. Now, this plan uses what is called the Carrington Network. And so if they go in network, it's called the Carrington Network. It's going to be like a PPO plan where they go out there and, the dentist files the claim, and then the client's just going to have to pay, what their responsibility is. And so whenever possible, I recommend going out and finding a provider in the Carrington network, because not only will the dentist process the claim, but they're also going to get some, pre-negotiated rates, and it's just better to go in network if possible. However, I get it. There's people that will say, well, I went to the same dentist my entire life and he's not in the network. Well, the good news is that if they go out of network, this plan uses what's called a passive network. And the way a passive network works is that it'll pay the same percentage. So it'll still be the 60, 70, 80% for, type 2 and type 3. However, it's going to be capped at the 75th percentile of usual and customary charges. Now, I want to clarify that. That doesn't mean that it only pays 75% of usual and customary, okay? It means that it's capped at the 75th percentile of usual and customary. So the way I explain it is, imagine that there's 100 dentists standing in a line and they all charge a different amount. If you go to dentists 1 through 75, in terms of the least expensive, it's going to pay just the same as if you went in network. However, if you go to dentists 76 to 100 that are the most expensive in the area, it's going to be capped at what that 75th dentist charged, okay? So still going to be some good benefits if they go out of network. That's how it's going to work. But like I said, whenever possible, go in network to Carrington. So that's how the dental benefit's going to work. Remember, dental, Carrington network, and go in network whenever possible. The hearing benefits are going to use what's called the True Hearing Network. And, I don't put enough emphasis on this, but they get some pretty significant savings for like hearing aids to go in through True Hearing. So basically what's covered under the hearing benefit is you get the hearing examination, and then they can use the hardware benefit or the benefit, to purchase hearing aids and repairs. But candidly, the savings they get on the hearing aids are some pretty good benefits. And there's actually some examples of that out on the public website that I'll show you. The vision part is not tied to a network, okay? So vision, no network. That means that it's going to be a reimbursement type plan. So your client goes to any provider they want, they're going to have to settle up with that provider, then submit the claim to SureBridge, and we're going to reimburse them any benefits owed. So dental, Carrington, hearing, True Hearing, vision, no network, it's a reimbursement type of a benefit. But here's how the vision and hearing benefits are going to work. You can see up there, eye exam covered immediately, no deductible. The hardware does have a 9-month wait, before they're eligible for that benefit, and then it's covered 60% year 1, 70% year 2, and then 80% year 3 and beyond. However, there is a $200 maximum vision benefit per year. So even if they have $2,000 benefit, they only can allocate $200 to the vision benefit, and their vision benefit will never exceed $200. This kind of confuses people. They're like, well, I thought it was covered at 60%, but it's only 60% up to $200. After that $200 has been reached, the client is going to be responsible for it. The hearing benefit is going to work very similar in that the hearing exam is covered 100% with the $75 max, which isn't going to be an issue if you go in network, and the deductible is not applicable, but the hearing hardware does have a 9-month wait, and then it's going to be covered 60, 70, 80. The hearing benefit has a combined benefit of $500 every 2 years. So they can use it all at once. They can, divide 250 and 250, but they can never spend more than $500 in any given 2 years out of the maximum benefit. So you can use, remember, if you choose $2,000 benefit for prime DVH, you can use all of it for dental. However, for vision, it's only going to, it's capped at 200, and it comes out of that, benefit amount, and your hearing's capped at 500 every 2 years. So just make sure that you're explaining that properly to your clients. As far as the premiums, up on the screen are going to be some sample rates. What I always like to point out is that you can see there's a pretty good price jump at age 65, right? You're jumping up, $11 for the $1,500 benefit. This is really, if you're working that turning 65, or you have clients that are 65, there's some incentive for them to get that locked in before they jump up, because if they're locked in at the 65 rate, they're always going to pay that 65-year-old rate. It doesn't increase when their age increase. So if you're kind of working that 65 market, now's the time to purchase, because next year it's going to cost them $100 or more to get the plan. So just a couple real quick FAQs. Will my client receive an ID card? The answer to that is it depends on how they answer a question on the application. There's a question on the application that asks if the client consents to electronic delivery. If they say yes, they do consent, they will not receive a card in the mail. They will receive instructions on how to download it online. If they answer that question no, they don't consent, they'll receive it in the mail. Now, if your client is 65 or older, we always send them a card. So if you're working that senior market, I recommend answering no to that consent. That way they get their policy in the mail too. But if they're over 65, they'll always get a card. Otherwise, it depends how they answer that question. To find a provider, you go out to www.SureBridgeInsurance.com, click on current customer, and then right down here, you can see that it says find a dental provider or find a hearing provider. And actually this, I need to update this slide because we actually updated our client portal and it looks a little bit different, but that'll get you at least to the same spot. Now, don't be confused about this, the find a vision provider, because remember, vision is not tied to a network with Prime DVH. That's for our standalone vision product. So if you're selling Prime DVH, remember the vision is not tied to a network. They go to any provider they want, and then then they submit the claim directly to SureBridge, and we send the money directly to the client. What should the client say when using the card? So they go to the dentist, right? And the dentist says, do you have insurance? And you say yes. You give them the card and say it's with the Carrington network. That's who they're going to be familiar with. If you say SureBridge, they may or may not know. Carrington, again, is the network provider and who's going to process that claim. So say Carrington when going to the dentist. Will the dentist file a claim? If you go in network, that dentist is going to file the claim, and the client's only going to be responsible for the difference. If you go out of network, it just depends on the dentist. Sometimes they'll file it, sometimes they won't. If the dentist doesn't file it, they're still eligible for their benefits. They just have to submit it directly to us, and then we would pay the client directly. Vision, remember, this is the third time I brought it up because this agents miss this. Vision is not tied to a network, so that will always be reimbursement. Okay, vision, always reimbursement. And then hearing, as long as you go to a true hearing provider, they will process the claim. So kind of the last, quick, sales ideas for you. Number one, in the senior market, I always say let the government sell for you, right? You're probably familiar with this Medicare and You handbook. Clients get it in the mail, sitting on their coffee table, turn it to this page, and it says what's not covered by Part A and Part B. If you scroll down, it says most dental care, eye exams relating to prescribing glasses, dentures, and hearing aids, and exams for fitting them. So this isn't covered. So if they need these things, and it's not a question of if they need it, but when they need it, they need some insurance for that. And so the Prime DVH is going to be the solution for them. So, flip to this page, show them that's not covered, and just say, hey, I have a solution for you that will provide some benefits for these things if that's something that's interests you. Finally, or I guess not finally, I got one more after this, but just ask the question, are you currently going to the dentist? Because regardless of how they answer this question, it's going to lead to a conversation about Prime DVH. So are you currently going to the dentist? And they say no. You say, is that something that interests you? And they're probably going to say yes, right? If you educate them on the benefits of going to the dentist, they'll be interested in it. So if they say no, they're not going to the dentist, just say, hey, great, let me show you a cost-effective way to go get some dental care. If they come back and say yes, they are going to the dentist, your follow-up question is, are you paying for that out of pocket or using insurance? If they say out of pocket, you just say, oh, okay, well, let me show you a more cost-effective way to receive dental care. If they say they are going to the dentist and they're using insurance, then your follow-up question is going to be, oh, does your dental insurance also include vision and hearing benefits? And chances are it doesn't. And then again, leads you into a conversation about Prime DVH. So this, just ask the question, and then depending on their situation, you can pivot to how to steer the conversation for Prime DVH. And then finally, just know the numbers, okay? I live in Nebraska, actually same state where Premier is located, and went out, pulled up these things, and all these are covered under the preventative services. And so again, I can pay one premium, let's say $35, and then go receive $300 worth of services from a dentist here in my area. And so, that's pretty good ROI on your premium to pay 30 bucks and then go get $300 worth of service. So know this, some agents will actually buy the plan, go to the dentist, get the bill from the dentist and say, hey, this is what my dentist here in our area charged. And, I didn't have any out-of-pocket costs because I had Prime DVH. So know your numbers, and just point out that, as long as you're going and getting those cleanings, you're going to receive a lot of benefits for the premiums that you are paying. So real quick, as I mentioned at the beginning of this, I did want to show you just real quick that HospitalWise Senior Plan Builder. If you're not familiar with the quoting tool, once you're activated, you'll go out to the agent portal, supsportal.com. Click on SureBridge Quote and Apply, and then it'll pop up this screen. So you click on Build a Proposal, and you have to enter in a zip code. Again, I'm in Nebraska, so I'm going to use a Nebraska zip code. An email address. Clients do need to have an email address to enroll in these plans. I'm going to enter in 65-year-old. And then once I have this basic information entered in, I click down here and I go to Save and Continue. Now this is going to pull up all the plans that the client is eligible for based on that zip code and their age. And so once this screen comes up, I just click on Add Plans. And then up here in the right-hand corner, you can see is where the HospitalWise Senior Plan Builder is. And so if I click on this, it'll allow me to select the plan year 2021, the carrier of the MA plan that I'm selling, and then the actual plan name, and I click on View. And this is going to pull up that MA plan, show the responsibility of the client, and then make a recommendation with SureBridge's HospitalWise. And so this is the #1 sales tool if you are selling HospitalWise plans, is that you pull this up, it's going to show the out-of-pocket exposure, and then you can quote it for the client. So hopefully it comes up here. Sometimes when I'm running webinars, it puts a strain on my internet from here at my home. I'll jump over here just real quick while that's pulling up. You can see right here is Prime DVH. It pops up under dental and vision. I can click on options, change the benefit amount, and once I have it, I click on add to quote 1. And let's see if this, well, I don't know, it might not pull up for me during today's presentation, but this is where you go and look. And remember, I did share that one screen that kind of shows how it lays it out. So definitely come out and use that tool. I'll make sure that it is working correctly after today's call. But again, it's probably just my internet. It's putting a drag since I'm doing this presentation on it as well. So with that, I'll kind of wrap up with just a little bit of, I guess, a little motivation for the rest of AEP and, selling ancillary products. I just always, I guess, challenge agents to ask, yourself, what type of agent are you? Okay. Are you the type of agent that only sells one thing because that's all you know? Or are you the type of agent that, educates people on options out there to address other needs? And if you're not talking about ancillary products and, that's the type of agent that you aspire to be, my question is, what are you going to do about it, right? Get contracted. We talked about the products. We talked about the sales process. We talked about quoting it and how easy it is. So just go out there, familiarize yourself with the tools and get started. Don't wait. Just decide that this is something you're going to do and go out and do it. So with that, John, I'll turn it back over to you. And if there's any questions, I can address them at this time.
Let's see. I think the only question that you didn't cover, Seth, was a question about the follow-up, and that's copies of the presentation. And yes, you are getting both a copy of the presentation and a recording to that. The rest of it, I think you've covered very well, Seth, for us, and we appreciate that for you. We appreciate that of you. And I will pull the controls back and finish with a few slides here, and we'll be done. Thank you again, Seth. Some of the things that we'll get as agents by working through Premier is actually access to a system that allows you to set up an agent profile and contract with carriers electronically to save us on the old, let's go through 60 pages of the contract, make certain I initial everything properly and sign when I'm asked to for multiple different spaces. There are circumstances where a carrier does not participate in this program, and we do a direct electronic link in most circumstances with the carrier in that situation. We also have an opportunity for you to purchase discounted errors and admissions coverage, and the reason we say purchase it is because it's a program you own and covers you regardless of who you are contracting through for different products. And many of the carriers obviously require E&O for contracting as well, so we have that in place for you, as well as a discounted continuing education bundle program through our relationship with WebCE, and an opportunity for you to pick up a modified guarantee issue DI policy on yourself, in which you share in the commission, a nice way to protect and enhance your own benefit structure you set up as an independent agent. Much as where today's presentation is being recorded, the vast number of other programs that we've ran that have a recording is available of those as well, generally through our website at premiersmi.com or through our YouTube channel. And these include both product information, carrier-specific product information as well, and then other marketing hints and tips to put you in front of a profile to handle the business that you're bringing in and help make certain that you are approaching all aspects of marketing within your target market. We have a new Medicare Center program that rolled out a few months ago that includes access to this, having problems talking today, CSG program, which gives you the opportunity to cross-sell within that system outside of the SureBridge system that Seth showed us and demonstrated or attempted to demonstrate a little bit ago. I think possibly you might also have lag in that system because there are a ton of agents using it right now as well. But it's a great way to add on electronically for different programs and piggyback a sale for a MedSup or a Med Advantage or PDP program for that matter, and add on the dental and hospital indemnity programs to that. Keep in mind the scope of appointment that you collect in most circumstances for a Medicare presentation includes a listing on a generic basis for both hospital indemnity and dental programs, and that presentation can be run in the same initial appointment that you have with prospects and clients. We want to emphasize the fact that those programs are payable upon issue, whereas the Medicare Advantage programs and PDP programs, because of CMS guidelines, we don't get paid on those until after the first of the year. So there's an added incentive for you to look at the different ancillary programs and how you best bundle those to protect your prospects and clients even further. It does also give you an opportunity to go back to folks that you've talked to this AEP that purchased or didn't purchase from you with an additional follow-up call that might make the difference in that underlining sale, but also give you a source of income from folks that bought from you and haven't this AEP. So something to consider there. That Medicare Center program is a singular sign-on for 3 quoting systems, including the CSG tool that we just saw, and the programs that are available and powered by ConnectSure and Sunfire are under that program. It does also offer you a complimentary CRM for you to track your business as well. Great system to work through and make certain that we maximize our opportunity. And since many carriers do offer trips and incentives, we want a singular place on our website to make certain that you can access that and see that you're getting full compensation for your efforts. And those do qualify you for the Premier Producers Convention, which is actually, because of COVID, morphed into a program where it's some additional cash for you based on your production throughout the year. Additional $4,000 is really, really helpful. And we have ways of putting you in front of folks as well. You can't cold call for MA or PDP. You can for MedSup, and you surely can for ancillary products. We can get you contact list butted up against do not call for a low or no cost to you, and also work with you to make certain that you realize that if you're working retail, generally you don't pitch a whole lot of the ancillary product on site. Walmart and some of the carriers don't like that too much, but it gives you the opportunity to set appointments and speak to those thereafter. Plus, in many circumstances, that's what you're doing at retail, is working up appointments and not necessarily selling on site. So we have taped presentations from the past on retail marketing, and also how to approach centers of influence in the community, such as faith-based organizations and providers. A great prospecting tool is approaching the dentist with the SureBridge plan in your pocket and making them aware of how you can help a dentist with their account receivables, because that's a challenge that they have periodically. Throughout the year, different carriers will generate prospects and make them available to us. If you work with MA carriers throughout the year, you may be on their list for getting carrier-generated prospects. Keep in mind that's kind of a quid pro quo situation. You scratch their back, they scratch yours, but it's an opportunity to get some additional flow that way. We do also have internet leads programs set up. We'll discuss those briefly in a moment, and direct mail support, which is a deep discount based on production through specific vendors that we have vetted to make certain that they and you stay in compliance and keep you out of that hot water that way. We have also 2 programs that set up that if you want to set up a direct mail campaign, but you want a little quicker turnaround, or you don't want to handle that entire expense, we have programs that can help you purchase the leads that have come back in different programs that haven't been worked before and are available for you. Keep in mind that once a lead is returned, the longer it stays untouched, the less successful it can be. And so we want to make certain that we flush these through as quickly as possible and make certain that they are hot for you as a follow-up response. We do also offer Facebook leads for final expense and Medicare. This is through an association with a vendor that works very well for us. The final expense people are having great success. We are seeing good returns for it on the Medicare area as well. We mention all of this because we want your business. We want to work hand in hand with you in the different areas in which we have our strengths. Premier is well reputed within the industry of working to earn your business, and utilizing strong carriers like SureBridge really helps enhance that opportunity for us all to benefit from this relationship. It is a program then that is a decision on your part. I had a old manager back in my Prudential days that said the decision to make a decision is a decision. If you've done that and you want to make certain that SureBridge is part of the material you have and the opportunities you have to present to your prospects and clients, put it as part of your marketing program. It's a system that if you set up a plan for AEP and moving forward, we want to make certain that that's fluid and dynamic, and we run across great opportunities like SureBridge. It becomes an integral part of our program, and we want to help you with that. Challenge is not waiting too long to do that. You can reach any of us here at Premier through our toll-free number of 1-800-365-8208 or through our website at premiersmi.com. I want to check really quickly to make certain that we have all of the questions answered, and it appears we have addressed them. Watch for the follow-up we send to you as a repetitious part of this, but I usually have this question pop up numerous times is, yeah, you're going to get follow-up from us with information that we've referenced through the course of the presentation itself, and a link to the recording of today's presentation as well. We will have folks reach out to you to make certain that we have an opportunity to work with SureBridge moving forward and go from there. So until we have that chance to speak with you, we want to thank you for the time that you spent with us. We realize that's your most precious resource. We look forward to providing value to you through the use of SureBridge and the other programs that we offer, the marketing support pieces that are there. And until that conversation, hey, we wish you good selling. Thanks so very much. We're going to talk to you soon.